Hello, my name is Jim Gardner. I'm the Medical Director at Blackpool Teaching Hospitals NHS Foundation Trust. This is my COVID update on Wednesday the 30th of March 2022. Actually, I want to start by talking about how busy our accident and emergency department is, if I may. We declared what we call an internal major incident on Monday because of the department being so busy. We've seen numbers up to as many as 130 patients in the department at any one time. And of course, our worry then is the department becomes unsafe for people coming in. So we're doing everything we can internally to optimise, improve patient flow through the department out into our wards, but we've been experiencing extraordinary numbers of patients coming in. So we've been working with the ambulance trust, for example, to cohort some patients in a separate space so that ambulances are not queuing outside, and we've been working ever so hard to try and make sure that patients can be discharged appropriately from the back end of the hospital, as it were, to maintain flow. But inevitably the request to everybody is to think very carefully before coming to an accident and emergency department, and really only come if there has been an accident or if there is an emergency, and to be thoughtful about self-care, to be thoughtful about seeking advice from local pharmacies, from GP services, and of course NHS 111 before thinking about maybe the need to dial 999 and call an ambulance or come straight to the department. So I kind of apologise to everybody, because if you have been in and experienced that level of busyness, well, it's not the kind of service we aspire to deliver. It's not what we all want for each other, for our loved ones, for ourselves. I promise you we're working ever so hard to try and resolve that, but it's if we can all do our bit, please, that would be incredibly helpful. The other piece of that, of course, is the piece about discharges. And so if you have a loved one in hospital at the moment and you can help them to get home because they're medically fit to be home and maybe waiting for some social package of care, it's incredibly helpful to do that. And as I've said on these briefings before, we know that long lengths of stay in hospital are really not good for people. Muscle bulk deconditions, there's a risk of acquiring other infections and so on. So it is actually really important for people's well-being to keep that movement going. So thank you for that. Just to come to the COVID numbers then, well, what we've seen across the Fylde Coast and also in hospital is a progressive increase in the COVID numbers again. So today we've got 129 COVID positive patients in hospital. We've got 118 in our GNA beds, 8 in Clifton and 3 in critical care. So there's a big COVID pressure in the system still, although, again, as I've said before, many, though by no means all of those patients who are in hospital who are COVID positive are in with something else. COVID is an incidental finding, but it has a big impact on how patients flow through the system. In the community, the numbers are very high again, 813 for Blackpool per 100,000, 928 for Fylde, 789 for Wyre. That represents a measured number of about 2,700 new cases coming through the system last week, so very, very high prevalence, and therefore being careful still about COVID is such an important thing to do. If you're over the age of 75, you're now eligible for the Spring Booster Programme, and you can access a booking for that through the government.uk website, but you will be being notified through your GP practices. And it's still the case that if you've never had a COVID immunisation or you've not completed your course, the programme is called the Evergreen Offer, and you can get the relevant update to your COVID immunisation programme again through the government.uk website. And we are running the immunisation clinic in Blackpool Teaching Hospital at Blackpool Vic, as we have been doing now for goodness knows nearly 2 years, I think. So vaccination is still really important and available. I should say something about flu, because we've started to see some influenza A cases circulating, and so if you've not been immunised against flu and you could be at risk, then I'd really urge you to do that now. It's not too late, even though we're in March. So I'd apply that recommendation to all health and care staff, and then also anyone who thinks they may be at risk from flu. So again, still available through our immunisation clinic. Excuse me. Lastly, just about testing. Well, we're going to stop in the hospital what we call our lamp testing for our staff, but NHS staff are going to keep testing twice a week with lateral flow kits, and all NHS staff can get free lateral flow kits on the Government UK website. I ordered some myself yesterday. It was very easy to do. So tests are still available, and we'd certainly urge all people to do that where they can. And if you think you are positive, it is still possible to get a test as well, and really important to do so. Anybody coming into hospital, we will be checking, and if you're booked to have surgery with us, you will be asked to do a lateral flow test before you come in for surgery. And again, you can access those tests free on the Government UK website. There's a little box to tick that just makes sure that the government knows it's fine to send you some kits. So I think the take-home messages are: the system is still extraordinarily busy. Although we're trying to normalise our world with COVID, the numbers are still really high, and there is still a big risk. And if you're not fully immunised, I strongly urge you to get immunised. Think about flu. Norovirus is also circulating, so those basic hygiene issues around hand washing, for example, are really important. And if you do think you have a diarrheal type illness, then please stay away from others and make sure your hand washing and cleanliness is as good as it possibly can be. And I guess the other thing is we keep going, and please stay safe. Thank you.